All right. Hello, everyone. We're going to give everybody a chance to just log in here, and we will get started right away. We have an action-packed, slightly technical presentation for you, and yeah, really looking forward to your questions as well. So welcome. Let's see if the chat works. Let's see if you can drop in name, what community you're coming from. And of course, we always ask if you do happen to know, and you should know, the Indigenous treaty area, or even the Indigenous name of the area that you're living, would be great to share so that folks can learn more about that. So let's see, we are already at 20 folks, and it's still just 10 o'clock. So let's give more time, and yeah, let's see who's saying hello in the chat. Hello, Aluko. Aluko, do you happen to know what Indigenous nation you're joining us from? What treaty territory? It's okay if you don't. It's not a test. Hi, Scott, City of Toronto, Treaty 13. Awesome. And Scott is with SafeTO, and I just learned more about what exciting work they're doing. I met with, I think with his department head a couple weeks ago at a Future of Policing conference at Massey Hall, and got to meet some of his teammates as well, but I think he was actually out of town that week, taking a well-deserved break. But hello to you. So let's see who else we have. Adrian Sheeher from Heartland Housing Foundation, serving Strathcona County and Fort Sask in Treaty 6 territory, Fort Saskatchewan. Excellent. We're actually doing a project up there on poverty reduction and well-being. So I think you might have met Jillian from our team. And Sharon Anderson saying hello. Heather Turner, no relation to us, or maybe there is. Mokinsis, Treaty 7. My name is Heather, and Association of Sexual Assault Services. Excellent. I was actually, I feel like I like know everybody now, but I was in Red Deer touring the new, really state-of-the-art, innovative, integrated service hub that's focusing on child advocacy. And I think I might have met some of your colleagues there yesterday. Maybe you were there too. Here's another one, Arifa from Project Manager Inequalities, Colchester, UK. Cool. I love seeing folks from outside of Canada. Nice to meet you and welcome. I'm not sure if this Indigenous treaty territory is going to apply to you, Arifa, but every nation has First Nations, and so yeah, if you happen to know if that's a thing in the UK. Martin from Sault Ste. Marie. Hello, Martin. And he's from Robinson Huron Treaty territory. David. Hey, David. We got to spend some time at a really cool bar not that long ago. So nice to see you. And he's actually with In From the Cold, which is a family, actually the region's only family shelter and based out of Calgary, so Treaty 7. Fear is Not Love. So this is Kamal Jaffrey, also Treaty 7, works with my good friend Kim Roos Blair, doing some really cool work in the domestic violence world as well. All right, well, we'll let folks trickle in, and there's 200 signed up to receive the webinar as well. So big interest in a, I think it's an interesting topic, but I like to nerd out on data. So let's see if you feel the same way. We will have folks monitoring the chat as well, so don't hesitate to ask questions in there, and we'll make sure we get back to you on those either today or follow through afterwards. So data-driven social systems planning, tools and strategies for success. This is, of course, our take on solving complex social issues using data. And by all means, it's one perspective. With that, though, land acknowledgement, one note as well from an announcement perspective is, if you don't know, June is National Indigenous History Month in Canada. So folks are encouraged to learn more about Indigenous cultures and contributions, and why the heck are we seeing such overrepresentation of Indigenous people when it comes to social challenges? There's a reason for that. If you want to learn more as well, our team has compiled a list of resources for folks that may be less enthused about digging into the data crunchy stuff, but more around movies and art and books that might give you a sense of this Indigenous history. And not for you guys specifically, because you probably are well versed in this, but for your staff teams or your friends and family. So we'll share that resource with everybody here today. There's a hyperlink in the deck, and there's a PDF with a list of books, movies, and artists as well, if that's of use to you. So today's, session, we're going to talk about data-driven decision-making and social systems planning. We'll make sure we actually define that. And then we're going to dig into 3 aspects of this in more detail. There's quite a lot of data that's involved in doing a good job on this. So we're only going to have time to touch on 3 aspects, but we'll do so in future webinars. We can dig deeper into other components of systems planning, data-driven systems planning as well. So one note about definitions. What the heck are we talking about when we talk about social systems planning? And to put it really briefly, to set context, it's a comprehensive data-led method for addressing complex problems that arise in society. Those problems might be everything from homelessness, community safety, et cetera, but also things like child abuse. And we did a webinar recently on pets and pet well-being and pet food security. So the issues that this can be applied to are so varied, but the methodologies are pretty consistent, and the data-driven approach is very consistent as well, because there's just basics that we should all know, no matter what issue you're tackling in your job, or if you move between organizations. These are skills and tool sets you can bring with you on that journey. The big unifying concept, though, is that it's a systems perspective. So we think about social problems from a micro, so that individual perspective, meso, organizational, program level perspective, and a macro, societal, community level perspective. And the power of social systems planners, and I'm assuming you guys are all systems thinkers, and that's why you would even sign up for this webinar, is that you tend to have this very rare skill of being able to go between those scales, to go from the macro to the micro and back up again. And you also tend to think across time spans. You can think about the beginning and end of the universe in the same breath as kind of going into a project really in depth around what's the next actionable step. So this is not normal. This is a very rare skill set, and these are very rare capabilities in folks. And we want to nurture that. We want to kind of give you the tool set and skill set to actually hone in on that probably that natural ability to think in systems. Again, it's very special, and you're very special to be doing it and building careers in it, because it's not easy to do. Also wanted to say that there are essentials to social systems planning that have been articulated over time. I'm showing you 7 out of those 10, because the next 3 we'll talk about in the future. But things like social infrastructure mapping, so understanding what the heck is happening in a community and what those assets are. Social needs assessments, we'll talk about that today. Community engagement, network analysis, systems leadership, org infrastructure, coordinated service delivery. These are 7 of the 10. My screen's cut off for the next 3, but they involve integrated financial planning as well, and accountability frameworks. So these are all kind of not necessarily science-led, because this is an emerging field, complexity science, but these are elements that, again, no matter what community or what issue you're tackling, they're pretty consistent. The things you need to do become pretty consistent as well. So we're going to systematically break these down in a series of webinars, blogs, toolkits, etc. But our Our next set of work is going to be really going into number 2 specifically, so social needs assessment, because we're going to have future webinars on infrastructure mapping and these other elements as well. So on the social needs assessment component, understanding population changes, demographics, and forecasting emerging social needs is really essential. It's really hard to do a good job on making these decisions that involved quite a bit of resources. So about $1 trillion goes into our social infrastructure every year. And you guys as social systems planners are part of the decision making on where this funding goes and what kind of programs we put in place, what kind of policies we put in place, which organization gets what funding to deliver what program. You're all involved in this decision making, and so it's a tremendous responsibility and opportunity, but the challenges are pretty complex to tackle. So you're dealing with things like addictions and mental health, homelessness and housing instability, community and personal safety, and everything in between. These are just some kind of headline issues that you're for sure coming across in your work, but it's not limited to these 3. So I don't want to give that impression. And the thing about your roles is that nobody's controlling or planning for the $1 trillion. It's all done in kind of a pretty fragmented way. And part of your jobs is to start to connect the dots and coordinating this in as real time as possible. Again, really tough to do, but a really essential job in this community. Data-driven decision-making for this is really important because it's tough to make the right call if you're not using data to make those decisions, and using your gut is only going to take you so far. Now, what do we need to do to get some of the science into the qualitative and anecdotal is going to become more and more important over time, because of course there's so much pressure on accountability. There's so much pressure on making data-led decision-making in our roles. So objective decision-making, there's lots of talk about depoliticizing some of these decisions. So we know councils come and go. We know policymakers might be influenced by the political for sure, but how do we bring those objective data-led political diffusion into the conversation so that we're making the right decisions based on data? Understanding community needs, predicting future trends, improving accountability and transparency, enhancing community outcomes. These are all crucially led by the accuracy and reliability of the data that we're using, that we bring to these decision-making processes. So hopefully you're here because you believe that as well. So what kind of tools and strategies do we need to have in our repertoire, in our skill set, in our toolkit to do this well? First, it's this concept, very, very basic. I want to take us back to the basics because we sometimes forget what the social data trends that are happening in our community, and we bypass them, we gloss over them, but they're so fundamental to this decision-making process to do it well. So social data trends, those basics on whether your population is growing, for instance, what segment of the population is growing? What does that mean for the area of concern that you're planning for? These things matter because you can't make assumptions that every segment is growing in the same fashion. And of course, there might be something that's changed over the last few years that is not on your radar as well. So going back to the basics is really essential in a systematic fashion. So decoding those community dynamics, understanding your data-led approach to community needs. So knowing, for instance, that there is a outsized proportion of a particular ethnic group in your community that wasn't the case 5 years ago. We have this data at our fingertips in every single community, and it becomes really essential to go back to it. And like I mentioned before, understanding and not necessarily predicting to a T, but anticipating what future community trends might be in the 5 years to 10 years ahead is going to shape what type of decisions you're making today as well. So I'll make sure to give you some examples here too. So things like average rent, and we always talk about housing, and I'm going to give you other examples, but the ability to look at these basic indicators and start to think about what they mean in a particular community, comparing them to what might be happening in a comparison community. So is your community's housing needs shifting in ways that are unusual as well? What shape is the housing market taking locally? Even something as basic as housing, even if you're not working on housing affordability, even if you're working, let's say, on shelter planning, if you know the housing market is moving in a particular direction, housing affordability is nowhere improving, but even digging deeper into the demographics that are being impacted. So, we're showing here 2 bedrooms and 3 bedrooms, but point being is, if your demographics are showing that a particular community's young families is growing at a higher rate than every other component of the population, your bedroom types are going to need to shift as well. And if you're not seeing that in your housing data, then you can probably make a pretty good argument that family homelessness might be on the rise. Family challenges, social challenges surrounding families when there is that type of core housing need stress are going to be on the increase as well. So making those inferences becomes really essential. Now, the thing about social planning is that it's very dynamic and the issues change all the time. So for us, the challenge has been, how do we serve up these insights and analysis in as automated a fashion to you guys as possible? And that's what we're also saying here too, is there's things you need to know as a summary, there's things you need to know as an analysis, and then there's the things you need to know from a recommendation or consideration perspective. So what do you need to understand for your specific area of concern? Why does housing matter for community safety, for instance? It's all connected, right? Because back to systems thinking, it's all connected. So the other piece to show you too is some of the safety indicators that might be happening at a higher level. So I'm showing you here Black experiences of discrimination. This is again basic data that's coming out of Statistics Canada, but digging deeper into things like the victimization rates in Alberta versus the national average. So being able to dig into the demographics and how some of these trends impact specific segments within the population. Showing you here some of this segmented view and multidisciplinary approaches to this will always go back to these aspects of identity and how important they are to understand from a data-led perspective. Indigenous experiences as well. So again, following that story and understanding why something might be happening becomes really essential. So I wanted to put a plug in for this data set too. After COVID occurred, we know that there's been a jumps in Black experiences of discrimination. Some people argue, well, it's gone up because people are reporting it more, there's more awareness. At the end of the day, it's there. The numbers are the numbers, the data is the data. Here's a piece from Statistics Canada that just came out this year, up 100% Black experiences of discrimination nationally. The other one to pay attention to is the jump in sexual assaults, 2021 to 2022, whereas crime index went down everywhere. One indicator showed an increase, and that was sexual assault. This all is related, of course. Victimization rates and actually understanding how your community, what's happening in your province, what's happening in your city in relation to these areas becomes really critical as well. So if we know there's an economic pressure on families and individuals, and it's going to have a gendered aspect, it's going to have a racialized aspect, paying attention to male versus female, for instance, is really essential. You can see here we pulled the Alberta data versus the national average, and folks in Alberta, we always want to be the best, but you don't want to be above the national average on this, right? So 17% higher than the national average when it comes to male victimization and 8% higher for female youth. That might lead you to say, oh, well, maybe we're not doing so bad on the female side. Well, no, not really, because if we look within that segment, we can see that young Alberta female victimization is 74% higher than that of young males. And then digging even deeper, looking at how extensively overrepresented Indigenous people are within that segment is even more concerning. So being able to tell the story with the data and then being able to link the data, the crime data, victimization data to those social demographics is essential, because if we know Indigenous people in a particular community, that segment is growing, and we know some of this victimization data is increasing, then what does that tell us in terms of prioritizing services and programs for this particular group? The other one to pay attention to is some of the addictions and drug use. So again, this is basic social data trends that are going to be impacting community safety, community well-being. Your poverty markers are going to tell you that if your low income population is higher, some of these addictions and drug use challenges become more acute as well. So making the connections is going to be important too. Here we're looking at addictions and drug use programs over time, and addictions and drug use deaths over time and on a per capita basis. So don't forget to consider things like per capita as well, because just because your numbers might be low, if you look, and here we're looking at Lethbridge, 138% higher deaths from opioids in Lethbridge than Calgary. So no death is acceptable, but when you see this, it's really critical. And of course, when we dig deeper into the overrepresentation of Indigenous people within that, it's very alarming as well. So you can start to put the data together to tell these stories and drive decision making and align stakeholders. The other piece to consider in your, again, in your repertoire is this concept of correlation analysis. So what is the connection? This is what I'm trying to kind of tell you guys about, is what's the connection between indicators, what's interesting, what might be causing some of these challenges, and what might we do about it? So if we know from systems planning work that everything is connected, then we should be taking that approach to our data analysis as well. Correlation analysis is essentially when you're looking at different indicators and you're trying to see what the relationship between them might be. And not everything is equally connected, but it might actually beg you to dig deeper into something. So here I'm showcasing you something that was surprising or puzzling for us in a project we're doing in Edmonton with Homeward Trust Edmonton. And one of their big focus areas is Indigenous overrepresentation in the homeless population. And of course, renter core housing need is an essential metric there. What we see here is Indigenous population and Indigenous identity being correlated to crime severity index. Now, the expectation when it comes to your usual analysis of core housing need is that lower income neighborhoods, for instance, tend to have higher crime rates. But what we're actually seeing in this context is that it's going in an opposite direction. So the more Indigenous people in core housing need in this particular community, the youth crime severity index is lower. That doesn't make sense, right? That's surprising. So of course, it actually points you guys as systems planners to say, what's going on here? Let's dig deeper into it. So I'm not gonna tell you the results of this because we're in the middle of examining it in further detail, but this is what correlation analysis can help uncover is, yes, expected correlations. And again, correlation is not causation. Everybody knows that on the call. But what might be happening that's unique in Edmonton that is not happening anywhere else? And the data is pointing us in a direction to dig into further that we didn't anticipate. So data-driven decision-making becomes this discovery and exploratory process as well. Here's another one to chat about. Outliers. So how is, and this is again Red Deer, I'm sorry for all the Alberta references. I just happen to have been spending a lot of time traveling across Alberta this month. So these are coming from my presentations there. But in Red Deer, their obvious focus for this presentation was to make the connections between child advocacy and child well-being and what's unique in Red Deer as well. And so we actually looked at outliers. What is unique about Red Deer? Where do they score much higher on some of these indicators that we don't see anywhere else? So outliers refer to these indicators where the value, the result in this community is significantly different from the average. And this is Red Deer, where they just are completely out of whack with the rest of their peer communities. More movable dwellings, higher average income, more people working in mining, oil and gas, more people working in retail. These are some of the pieces that came to the forefront for this community. And of course, the question becomes, how are these related to child well-being? Might these be leveraged? How are these a strength? How are these a protective factor? But how might these be also a risk factor in the community for us to be aware of? So higher average income, of course, usually you have better outcomes when you have higher than average income, which probably is a mitigating factor locally. It's a strength. However, we also have this really major segment of the population that is unusual for the country, that's working in, no surprise there for those of you that know much about Alberta's economy, but working in oil and gas and mining. So of course, there's usually higher average incomes, but it's also a sector that's very volatile, right? So lots of stressors. You might be higher income, but the ups and downs create significant stress. And of course, that's related to our higher than average domestic violence rate that we talked about before for Alberta. So again, paying attention to these components and building strategies that recognize this, that are data-driven, becomes really essential as well. So the other component, oops, sorry about that, bivariate analysis and geospatial data, another essential data tool in your systems planning toolkit. Geospatial data is sometimes the only way people can connect to data that are decision makers. So I'll show you some of the visuals that people really responded to that had zero background in data. And the reason I'm pulling these ones out is because I think people, they see a map and they intuitively understand why this is important. So in this particular session, there was 300 folks in the room, and I got them to put up their hand and say, okay, how many of you are working in the social sector and working on social issues? And it was 300, right? But then I asked how many of you are, in health and education and social services and policing, corrections, et cetera. So pretty nice mix there. How many of you are familiar with data, and how many would you say are good with data? And nobody put up their hands. Then I asked, like, how many of you appreciate data and love the value of it? And of course, lots of people put up their hand. That's why they were obviously in my session on data. But the point is they might love data and value data, but they're not data people. So we need to actually bring to them things that are pretty, I don't want to say baked, but you want to bring to them decisions and insights that you've already processed for them so that they can get the most value out of them. And bivariate analyses, so looking at two indicators at the same time, using geospatial, using mapping, it becomes a really cool way to do that. So it lets you explore the relationships in a visual way. It lets you show those correlations and explore possible causations in a visual way, and gets people in that systems thinking mindset because you're able to explore simultaneously. So here's one that we did for Langley in British Columbia. Again, I'm not saying this is obvious, but I'll tell you a little bit about what we did here. So on the green side, the darker the color, the closer the walking distance, thus accessibility we had to services. So the black dots are social services available in that area. And you can get fancy, and we can talk about whether it's a food resource or a mental health resource, but these are all of the social infrastructure resources there. So the darker the color, the closer the proximity, the more accessible something is. But of course, the lighter the color, the further the accessibility is. And then on the other side, in the purple, same concept. We looked at the depth of core housing need and where you have the most folks in core housing need. And you can start to see misalignments as well. And that's the power of visualizing this stuff. So the last one is when we put all these together. So in the dark, in the black, almost the darkest color is where we have high core housing need and high proximity. So that's actually a good thing. That means we've got this one neighborhood here, or this kind of concentration of neighborhoods in the middle here, where we've got both resources and need. But then, of course, if you think about it from the other side, if we looked at the purple, the deeper purple, we might have we might have a need, but not have a lot of services. So this gives you an idea of where we might have mismatches as well. And again, the point is that you're visualizing this and you're kind of serving up these insights in a way that people can relate to as well. And of course, the next natural step would be, this is where we should be putting our new family program, or this is where we might put our new affordable housing service, because this is where we have need. And you can do that for any social issue as well. So some community examples a little bit further. I wanted to give you a sense of how we approach this as well. So building this holistic response, again, requires us to think across systems and to have a bit of a framework on how we're going to approach it. And you're all coming from different sectors. I've seen the list of who's here. You're all operating at similar roles, however. You're all involved in social planning to some extent. But not everybody has the same kind of budgets or the same areas that you're planning for. So we need to have some kind of a framework to unify all of us as systems planners. So we for ourselves use this prevention lens, and we use well-being as our unifying response. So when I talk about well-being, I'm looking at the person holistically. I'm not segmenting them into all the different aspects of their identity. I'm saying they're all relevant. So we need to look at all the demographic markers simultaneously as their needs from a holistic perspective, as well as their protective factors. So well-being as a concept gives us that framework to say, it's not just about transportation, it's not just about housing, it's not just about mental health. All of these aspects are components of well-being, and there's 15 dimensions of well-being that we'll dig into future webinars to give you an idea of how you might use this framework in your work. But we know that when you have high well-being, you have lower needs for social supports. You're not as likely to need affordable housing because your income is adequate, et cetera. So things like primary prevention in that bucket tend to work really well. And we've got universal prevention that does a fairly good job. Your universal healthcare, universal education system, they're tailored towards that population that is doing relatively well. However, as we go deeper into a population and segment it further, we know that sometimes things, you're in households where there's moderate needs, or there's things going on where somebody might have a health challenge, a disabling condition. They might live in a low income context. They might be new to Canada. They have lots and lots of areas that might be impacting their overall well-being. So usually there's a correlation, of course, between your well-being being moderate, and chances are you have some moderate needs. So things like secondary prevention become really important, where we know that there's a presence of some risk, and so a tailored prevention could be really valuable. So a rent subsidy, for instance, it would be a good example. You're keeping somebody from becoming homeless, and you're intervening with something that is tailored to that secondary prevention layer. And then, of course, at the bottom, and these are all kind of in proportion to their likelihood of occurrence in a population, we have low well-being and high levels of need. So, of course, when you're not doing so well, you're going to need more services, more support. Pretty logical. And that's where things like tertiary prevention become really important. So again, using some of the examples of child advocacy. So for the child advocacy world, the example would be that treatment, that intensive treatment for kids that have experienced child sexual assault, for instance, and they're in that intensive therapy, sometimes intensive place-based treatment as well. That's That was the program that I visited yesterday, for instance. So that's where the risk is already there. The harm has already occurred, and we're now in that treatment and recovery space. There's another concept called quaternary prevention. And that's actually hasn't been on my radar before, but it's the concept of systems not causing additional harm. So it's when a population's already been receiving services at that tertiary level, but those systems are actually causing additional harm to them. And so you can probably name a few of those. So this concept of quaternary prevention is coming to the fore in our vocabulary, and I haven't done enough research to present to you what in full scope, but it's on my radar. From a kind of high level analysis, and it's not always the case, but generally, or at least in kind of the Pareto rule of this, is that you've got an 80-20 split between the primary prevention, secondary, and tertiary, where primarily your majority of your population is going to be served well. They have relatively low level of needs. However, it's the ones that are in this 15 and 5% buckets that we're really needing to double down on and really analyze further, because this is where we tend to see the gaps, is in the tertiary and secondary prevention, when we might do a pretty good job in the primary, but not in the bottom of the triangle. So I want to give you an example that recently emerged for us in the school-based gang prevention area. This is the Township of Langley in partnership with the City of Langley. And if anybody hasn't become familiar with the Building Safer Communities Fund, it's a really interesting initiative by the Government of Canada, Public Safety Canada, that's actually leveraging municipalities as systems planners, as social systems planners, and saying, you know, you're the closest to the ground. What about doubling down and investing in your ability to do this well? So something that's generally not in the realm of many municipalities is to do crime prevention. Sometimes it's the policing space, or some of the correctional services and provincial services in that area that do this work. In this context, though, and I know some of you are already receiving this funding, so it's a shout out to you and the work happening there. But this Building Safer Communities Fund is bringing funds to the municipality to tackle gang prevention, guns and gangs, actually. But in this context, I'm going to speak specifically around gang prevention. So City of Langley received $825,000 over 3 years from this funding. So relatively small amount of funding for 3 years to do something in this secondary prevention realm specifically. So they wanted to do something backed by data, and they wanted to do that in a way that proved to the decision makers, municipality, and Government of Canada that they were taking a data-led approach here. So they dug deeper, obviously with a little bit of help from us, on crime severity, looking at service accessibility, looking at how what the risk profile of families were in their community, and starting to do some of the segmentation based on well-being to understand where to intervene best. So based on that, they were able to develop a partnership with Langley Schools to create secondary prevention programs focused on this specific group. So they created a program that had a pretty high level, high touch of support, because they understood how essential that outreach worker to youth ratio was, and how important a clinical intervention was. So it wasn't good enough to do a kind of raise awareness program, because they already had data to show that there was a segment of their population. There was about 130 kids that had high levels of need that required that high touch support. So they created this service that had outreach clinicians, youth clinicians working with the youth. They also learned from the data that poverty and accessibility to services was a major challenge. Langley is an interesting place because it's especially when you consider the township, it's spread out quite a bit, and all the services tend to be clustered and not, interestingly, not where the kids are, right? So they needed to consider that. They also saw a major challenge when it came to clinical therapy, drug and alcohol counseling. So the trends were showing them that in Langley, there was key segments that had higher risk profiles and families that needed mental health and addiction support, putting them at high risk, right? Because you often don't have gangs if there's not drug trade involved, right? So there was a relationship there that they recognized in the data and saw this risk, and they saw a major gap when it came to flexible therapy and drug alcohol counseling, transportation, basic necessities, recreation, so keeping kids busy after school and getting them involved in these activities, and with counseling, so like that deep counseling that needed to be tailored. What we learned, however, is that the needs of each family were so unique that saying to them, you're all going to this one clinician for therapy and you're going to get 6 sessions of DBT and that's that, was never going to work. So what the design was as a result was actually a youth well-being fund, where on average the youth were getting about $5,000. Some are going to get more of a fund than others, like not everybody needs the same level, but just for average purposes, this youth well-being fund, between the youth, the family, and the clinician, they're able to actually go to market and purchase these services, whether it's a membership to the Y or the city facilities, which we can get cheaper because of course the city is a partner, but also things like art-based therapy. There's no nonprofit art-based therapy. You actually have to go to a private practitioner to purchase those hours as well. So being able to tailor this intervention and having the flexibility was a pretty big jump in terms of program design, because we listened to the data. So this flexible, resourceful approach was able to understand the impact of COVID and those complexities needed for high-touch sustained support for youth. So we learned that COVID in this community really amplified some of those mental health challenges. So we saw that in the educational data, where kids started to have absenteeism, lower grades, and families were struggling further and further because of the recession, recessionary inflation that we are seeing and are still experiencing, unfortunately. And lastly, that after school support. So understanding that lots of these families have had to take on 2 jobs now, and outreach workers are going to need to operate very differently. So yes, school-based, however, flexible to wrap around the family as well. So that ability to go between 1 p.m. to 8 p.m. and year round. The really exciting thing here, though, from a systems planning perspective, is the ability for this the municipality to partner with the school district to deliver this. And so leveraging the school district as that space where youth are already gathering and coordinating access to about 237 programs that are already in the community, but then doubling down on those gaps and using that relatively small amount of money to make a major dent in this risk population. And what's cool about what they're doing in Langley is that they're actually able to target about 60% of the youth in that risk profile. So it's a small amount of money, but where do you use it most effectively to actually impact this particular issue? There's a way to do it in a targeted way as well. So I'm actually pretty good on time, and so I'll give you a plug for our next webinar, where we're going to be again following this line of thought to our to systems planning and the tools you need to make these decisions. But next time we're going to be partnering with our friends at the North Pine Foundation, and actually as of yesterday, the Sector, which is a consulting group, a social finance consulting group as well. So I don't have their name here, but they just came on as a webinar partner with us just the other day. So the 3 of us are going to be talking about financial trends for effective social planning as well. So we're going to be launching a new free tool for you guys as well to take advantage of, but not just learning about social data trends and how they're related to program planning and systems planning, but actually using financial data in understanding and digging even deeper. So please do sign up for this one. We're hoping to make these interesting, technical, because we're targeting folks that are on the ground using data and decision making, but also giving you tools that can make your life much easier. So think of us as the kind of the ChatGPT of social data trends. How can we serve up these insights in as easy way as possible and bring them to you in a way that you can mobilize quickly? Because your work is highly political, your work is relationship focused. You can't spend your entire lives mining data and writing reports. Relying on technology to do some of that is gonna help you be more impactful as well. But this is one set of tools that is going to be really cool for us to walk you through, and North Pine giving you an idea of how they're using it in determining funding decisions as well, and how they're thinking about their funding portfolio using financial and social data so that they can target that investment strategically. So that's going to be a really great one. June 22nd. Sorry, it's always MST we talk about just because we have a bias of myself being in Calgary, but 12 noon MST or 10 a.m. EST. And in BC, we'd be looking at 1 p.m. So looking forward to that. You'll receive the package and invitation to it after this webinar as well. And then, of course, product updates. We have releases on our Cardo product every 2 weeks. The next one is these social data trends that I talked about today. There's a new release of those coming out actually June 7. And then June 21st, it's the automation of those insights. So if you saw on the side, we talked about, how do we actually interpret this stuff in a way that you guys don't have to write all these, here's what this trend is telling me. We're automating that so that you can move on to more important things. But that's gonna be starting to happen at pretty hyper speed. So if you want to keep up with what we're up to, please do sign up for our newsletter. We promise not to inundate your inbox with too much junk. But things like product updates, case studies, future webinars, blog posts. We just had a blog post come out last week on social systems thinking and best practices. So definitely sign up for that if you want to keep on top of things. And the other one too is, shaping our next feature. We are always looking for folks that have an opinion. And David was really great from IFTC last year when we started all this to say, hey, that's kind of cool, but that's kind of not. So, or how can you make this even easier for me? How can you actually, make my life that much more smooth because I don't have to do all this boring stuff. So we love hearing that type of feedback. And so we will be reaching out to folks that are shaping our next feature as well. Every 2 weeks means that we need to always be chatting with you guys about things you're interested in seeing in the product so that it can bring that value to your work and help you with that work-life balance. So there's a plug for that, and I'll leave it up here and I'll see what questions we've got. All right. So Sharon's asking, we're supporting family care navigation is a huge pain point for the healthcare providers. And so I'm guessing you might be interested in some of our work around systems navigation. We will definitely be having a future webinar and best practices on systems navigation. That's when we look at the entire spectrum of services in a community, and then how you develop guides, for instance, for users to access those services. So definitely, and there is a free tool at helpseeker.org, our Navigi app that gives everyone access to support services across the country. You can also sign up for free if you are a provider as well. Let's see if we've got any new questions here. Data sources for analysis. Ooh, interesting. So depends on which part. So we've got some data that's pretty open source. So things like Census Canada is a major one. So anything that's population demographics, things like that comes from Census Canada. That's the official data source that we should be using. So absolutely that's a major one. For financial data, it's Canada Revenue Agency is our major source. For the supply map, so the services in a community, there is no source, there is no official source. So with funding from Canada Mortgage and Housing Company, we developed our own data source to do that. So that's where we scrape websites and turn that into data and then visualize it in the product. There's also folks that actually sign up to be part of the data set as well through our app. So that's an example of a source that's less obvious. Things like crime rates, things like mental health data sets, those get a little bit more intricate in terms of where we have to source that data, but it's usually health systems or policing, right? So RCMP has a data set. Statistics Canada keeps some of this data as well. So our job is to bring it all in, make sense of it, visualize it, and then serve it up with insights so that you can generate your reports and move on with your lives to the next thing. So hopefully that helps answer that. I got another question here. What level of census data communities that fall specifically? Yes. So yeah, you're talking about those tiny neighborhoods. Those are census dissemination areas, DA. Yeah. So our data goes to that level because you're absolutely right. You can't just stay at the CSD level. The CSD is like your city level. Or your regional level. Those are all interesting, but things get really different when you dig deeper into that small, tiny population area. I think about 2,000 is the guideline for the dissemination area. So that's a great question and really important to look at DA's dissemination areas. And Martin's asking, learning how communities have used data to make decisions and what the results have been. Community safety, mental health and addictions, housing and homelessness. Good one. I'll give you an interesting answer because it all depends what the goals are and who's using the data, right? So data is data, right? Insights are insights. There's only so many ways you can spin things, but you can spin them quite a bit still. So as a really good example in Alberta, and Alberta's got an interesting tension right now with BC around harm reduction. And there was a report that we did on looking at social trends and resources in the mental health and addictions area. And one of the things we found was that there was kind of an increasing gap in specifically in mental health addictions and homelessness, so that tertiary intervention. So for a province that's really keen on treatment only and things like that, they actually made a pretty big announcement before the election to invest further in mental health addictions and homelessness. So we are seeing that even in communities that might have tensions around these issues, where you have a really good data-led business case for additional investment in a particular area, you can still make a decent argument for adding resources in those gap areas. Now, on the other side, there's also communities, and I talked about Langley a little bit, where the data can actually point you in a better direction than you would have otherwise thought. So initially in Langley, we thought we might end up with a new recreation program for youth to kind of keep kids out of trouble, et cetera. But when we dug into the data, and it wasn't just us, it was the entire community that used the data, we actually found that it was this mental health after COVID was such a major issue, and it was specific neighborhoods that had these gaps, high neighborhoods that had high proportion of children, and proportion of children with parents that were really, really busy and potentially disconnected from their kids because they were working 2 jobs, et cetera. So not always low income, but families that were just under duress, under stress, that were a major concern. And those neighborhoods, they weren't concentrated, they were kind of all over. And that's what led to the decision to actually partner with the school district, because the school district could actually have that regionalized yet targeted approach. So we had to have a partner that could work at that higher macro level, but at the same time nail those the reach into those neighborhoods, because we only had $800,000 to make that impact. So of course, the impact is that you can actually follow the kids and see over time that their well-being is getting improved because of that intervention, and that, over time, if it works, right? Because we're just at the beginning implementation phases. But if you're creating this targeted prevention, counseling, mental health wraparound model for these 130 kids over 3 years, those are the 130 kids that are on everybody's lists, right? Our CNPs had interactions, child intervention has had interactions, school district has, had interactions. Of course, they're watching everybody, but that team can then actually show those outcomes pre and post, and we can then link that to reducing the gang involvement and gang involvement risk over time. So that's how you would use the data in really practical way. See if we got one more. Okay. Yeah, I think I answered that one. So I think we're good. Any other questions? And we're good if there isn't as well. We're happy to let you go a little bit earlier. Let's see. I think we're good. Let's see. Oh, Sharon. I think I answered that one. Yeah, I think we're good. Awesome. Well, I will let everyone go, and hopefully this was useful, insightful, lots of data, but I think you're data people, so I think we're okay. And yeah, we'll be sharing the deck, presentation, resources, and we'll see you next time. Thanks so much, everyone. Bye.